topic for discussion is principles of tooth preparation. Despite the advances in prosthodontics, complete restorations or full coverage crowns or the traditional crowns are still the treatment option for many patients. So hence, proper understanding of the principles of tooth preparation is very important, which will actually help you in incorporation of any modifications if required. What are the objectives of tooth preparation? The objectives include minimal reduction of the tooth to provide proper retention. Also, preservation of healthy tooth structure in order to have good resistance form. The third one being the provision of acceptable finish line and also good and proper axial reduction, which will actually help in other favorable tissue responses and aesthetics. So, Rosenstiel has classified principles of tooth preparations into three divisions. First being biologic, the second one mechanical, and the third being aesthetic. Starting with the principles of Schillingberg has classified the same principles into 5 divisions. The first one being preservation of tooth structure, second, the retention and resistance form, third, structural durability, fourth, marginal integrity, and fifth, preservation of periodontium. So this topic is according to the Rosenstiel's classification. So coming with the first biologic considerations, the first one being prevention of damage during tooth preparation. In such cases, you have to consider the adjacent teeth and the adjacent soft tissues. So in adjacent tooth, there are chances that and which are inevitable that there might be iatrogenic damage to the adjacent teeth while you are breaking the contact. In such cases, it is better that you use a matrix band against the adjacent tooth so that you might actually avoid nicking the adjacent tooth, because though the adjacent tooth is nicked and if it is managed with fluoride coverage also, this might not help you reduction of the caries risk. So once the tooth surface is manipulated, in the sense if it loses enamel, then it is at a high risk when compared to the other undisturbed surfaces. So in preservation of adjacent soft tissues, you should have proper retraction of the tissues, the cheek and the tongue. Suppose if there is preparation of lower teeth, the lingual surfaces, in such cases you have to be very careful with the tongue placement. So in such cases you have to use proper retraction instruments like the mouth mirror or the sphincter or the cheek retractor. Coming to pulpal protection. During preparation, due to the high speed, there might be many thermal injuries to the tooth. In such cases, you have to take care during preparation, which includes you have to correct the speed of rotation. There shouldn't be any continuous preparation. You have to prepare for 5 seconds and then give a break. So there should be pulsations in preparation, like every pulsed 5 seconds you have to give a break. In such cases, this might help in dissipation of heat and also use of proper coolant. And also check the instrument age and use of pressure. Instrument age in the sense you have to use a proper instrument with proper diamonds. Just in case the diamonds are worn out, you might have to apply more pressure to have the required amount of tooth reduction. In such cases, the more the pressure, there might be more heat generated and this will be transferred to the pulp and pulp might be affected. So all these factors are interrelated and you have to check for all these factors. And there are inevitable chemical injuries happening to the pulp in cases where you use your strong luting agents. So in such cases, it is advisable that you cover the tooth with a proper varnish before you go ahead with the impression procedures. And also bacterial injury. During preparation stage, if there is any carious area, you have to totally remove the carious surfaces, just in case if there are any remnants of caries, and once the restoration is seated, there might be disease progression under the restoration and this might one fine day lead to pain and failure of the restoration. Hence, it is must that you have to remove all the carious lesions and carry out other extensive radiographic and restorative procedures if required. Coming to conservation of tooth structure. In conservation, you have to first think about the partial coverage restorations, which will actually guide to the minimal invasive procedures. So you have to preserve the tooth structure. Just prepare the amount that is required. So in case where you can actually go with a partial veneer crown, that is very well suggested than full veneer crown. And also preparation of the teeth with, in case of full veneer restorations, you have to prepare the axial surfaces with minimal taper. This will actually help you in many other resistance and retention forms. Occlusion reduction, you have to follow proper anatomic planes. Never make a flat reduction on the occlusal surface. If you follow the proper anatomic planes, there will be even thickness of your restorative material, which will actually help in proper aesthetics and proper structural durability. Then preparation of the axial surfaces such that the restoration can't be removed easily. This is guiding towards your path of insertion. Your restoration should have only one single path of insertion. Selection of a proper margin so that this is in harmony with the surrounding biologic tissues. If the margin is, or if the restoration is demanding that you extend the margin subgingivally, you have to see that the surrounding tissues are not damaged during preparation. And avoidance of unnecessary extension. Only in cases where it is must that you have to extend subgingivally, never go or extend into the subgingival tissues. Make it a supragingival margin. Coming to the considerations affecting future dental health, these include your axial reduction, the margin placement and margin adaptation. Axial reduction is to be taken care of during your stages of preparation and also the margin location. And margin adaptation is actually taken care of during your the lab procedures during fabrication of the restorations and also during cementations. So all these factors affect your future pulpal health. Coming to the types of margins. According to the location, the margins can be either supragingival or subgingival. So what are the advantages and disadvantages of each type of margins? Coming to the advantages of supragingival margins, they can be easily finished. They are more easily kept clean. As it is above the gingival margin, you can actually prepare it properly, and during cementation steps you can assess the condition correctly, if it is really seated or not, or if the margin is open, and this will actually help you arrive at a proper conclusion if the margin is perfect. And if it is perfect, even the maintenance will be perfect. So indications of subgingival margins. In cases where there are erosions and dental caries extending onto the root, or if there is any root sensitivity, this will actually demand you to extend the restoration to the subgingival tissues. In such cases, it is mandatory that you have to extend it to the subgingival areas. And also in cases where there is less crown height, in such cases you have to, in order to increase the retention, you have to extend subgingivally. In such cases, it is indicated. Also, if the proximal contact is extending to the gingival crest, you have to obviously extend your margin to the subgingival tissues. And then if there is any need for additional retention, like if the occlusogingival height is less after preparation, in such cases you have to go with subgingival margins. Next, if you have to mask the margin of a metal restoration, like if you're giving any metal ceramic restoration in the anterior regions and if the lip location is high, in such cases you have to mask the metal shoulder, so you have to extend the restoration subgingivally. Then root sensitivity and in modification of axial contour. If the tooth is highly contoured, or if the contours are too high that you have to go with more amount of axial reduction, in such cases you might have to extend subgingivally. Coming to the margin geometry, what all are included under the margin geometry and why is it important? So if the margin geometry is proper, it helps in the ease of preparation without overextension and helps in identifying the proper seating of the restoration, and also helps in identifying proper margin during die preparation. So once your die preparation is proper due to proper finish line location, you will be actually able to give a proper restoration. Coming to the next factor, the retention form. Retention form is in turn affected by two factors, the path of insertion and the taper. What is the path of insertion? It is the direction in which you seat your restoration. So less the number of path of insertions, more is the retention. Hence, it is ideal that you have only one single path of retention. What do you have to do in order to have a single path of retention or path of insertion? In such cases, your axial preparation should be minimal. The taper or the convergence should be minimal. The total taper should be only up to 6 degrees. So on single side being 3 degrees. If the taper is more, there will be multiple path of insertions or path of removals, reducing the retention. So taper. Taper goes hand in hand with the path of insertion. The taper should be uniform. So the total taper should, or the angle of convergence should be 6 degrees. Coming to the surface area, try to preserve the height, no over reduction. So once you maintain proper occlusal gingival height, minimal height, this will help in proper retention. Just in case, compare a tooth. If you compare a premolar and a molar, so premolar is less in height and has a lesser surface area when compared to the molar, where it has more occlusal gingival height and more surface area. So in such cases, if you consider both the teeth to be the same height, the surface area is very important here in retentive factors. As the molar area has more surface area, in such cases, the bonding of the luting agent will be more due to availability of more surface area, and hence retention is more in case of a molar crown when compared to the premolar crown. Hence surface area is very important if you have to have a proper retentive crowns. Roughness of surfaces being cemented. So this roughness includes, you can actually sandblast your restoration, which will cause small roughnesses in the cementing surface or the bonding surface of the restoration, which might actually improve the retention. Coming to the resistance form. Resistance is the resistance to removal or displacement. So in resistance form, you have to have a proper occlusal gingival height, which will actually avoid the arc of removal. If the crown height is very less, it might have a tendency to rotate along one contact area. So in such cases, maintain proper height and proper convergence. Coming to the geometry of tooth preparation. In cases where you have to give a partial veneer crowns, you have to have a proper seat between the restoration and the tooth, because along with the vertical forces, there are many angular forces which are inevitable. So if there is improper seating, there might be chances or less resistance of the restorations to displacement. In such cases, you have to incorporate additional features like grooves, slots, boxes. Coming to the physical properties of the luting agent. Also, luting agents are very important in helping the restoration to be more retentive and resist displacement. So selection of the luting agent is also very important. This will again go with the amount of remaining dentin thickness and the type of restoration, also the area where the restoration is located in the mouth. Coming to structural durability. Structural durability in relation to the restoration. So in order to have a proper durable restoration, you need to have a minimal amount of reduction of the tooth for each type of restoration you select. So occlusal reduction. It should be done following the anatomic planes and contours. You have to maintain the planes and contours so that the same anatomy can be duplicated in the restoration, and the restoration will be evenly thick at all the areas. So according to the type of restorations, be it all metal or a metal ceramic or an all ceramic, according to the type of restoration you select, you have to go ahead with the amount of occlusal reduction. Coming to functional cusp bevel. This is one important step in your occlusal reduction. Considering the tooth, what is the functional cusp? It is the cusp where there will be maximum amount of loads. So in such cases, the thickness of the restorative material should be more in order to be more durable. In such cases, after proper occlusal reduction is done, you have to slightly round off the functional cusp by placing the reduction bar or the diamond at an angle of 45 degrees, so that the sharp projections will be rounded off, and this will actually help in increasing the thickness of the restorative material. So you have to do this in case of palatal cusp of the upper teeth and the buccal cusp of lower teeth. Coming to the axial reduction. Axial reduction should be as minimal as possible, and it should permit the required amount of the restorative material. In case of all metal restorations, the axial reduction will be very less due to the ductility of the metal. But whereas in all ceramics, the axial reduction should be up to minimum of 1.5 to 2 mm. which is actually demanded by the material properties. As it is very brittle, you have to increase the thickness. Coming to marginal integrity. What is margin and what is finish line and what is marginal integrity? A finish line is the point at which your preparation terminates. This is and also it defines the peripheral extension of the axial preparation. So a proper finish line is very important in order to have a stop of the restoration. Once the finish line is proper, this will help you to measure the proper amount of tooth reduction, to evaluate the accuracy of the impression made. So once you make an impression, you have to see if the proper finish line, if there is proper finish line, you can actually assess the condition of the impression in relation to the finish line. If the same finish line is duplicated in the impression, then yes, your impression is correct. So that is how it will actually guide you in order to have a proper impression. And once the impression is proper, once you get the once you get the working cast, in such case you have to actually evaluate the finish line. So once you give a proper finish line clinically, and once it is duplicated in your impression, then the same thing is duplicated in the cast. It will be very easy for the lab person to work on it. So all the laboratory procedures which will be carried on the cast can be assessed in relation to the finish line. So coming to the finish line, so once the cast is ready, you can actually prepare the die, proper die. Once the die is prepared, coming to the wax pattern, you can assess the type of type fit of the wax pattern. Is it really extending to the finish line? If there is any open margin, if it is open margin, then this same will be duplicated in your final thing. So once you have a proper finish line, you can actually standardize all other next steps. So it will help in proper diagnostic impression checkup, and also helps in proper die fabrication. Once a die is proper, wax pattern will be fabricated, and once this is casted, it will also help in proper fitting. Once the restoration is attained, then it can be first checked on the die. This will actually help you assess the fit of the restoration before you actually cement it in the mouth. Coming to the type of finish lines. First being shampoo finish line. Finish line is actually seen in relation to the gingival stop and the axial margin. In shampoo finish line, you will have a smooth rounded margin. The finish line curves from axial surface to the gingival surface. Due to the rounded margin, you can actually, this is ideal for metal ceramic restorations where you can nicely burnish the metal. Coming to heavy chamfer, the amount of axial reduction will be more. So this will actually lead to more seat on the gingival margin. Coming to shoulder, this is the second type of finish line which is ideal for all ceramic restorations, where the internal line angle will be 90 degrees. It is not rounded unlike your chamfer finish line. So due to the sharpness in the finish line, or due to the more reduction, this amount of roundness is removed. So it will be done by a flattened torpedo, where there will be more amount of reduction on the axial surface. This is ideal for all ceramic because due to the more amount of reduction, you can incorporate that bulk of ceramic material there. Coming to shoulder with bevel. This can be done in cases like over-contoured molar restorations which are going to have metal ceramic restoration. In such cases, you have to reduce more. So go with a shouldered bevel. While a normal shoulder has a sharp 90-degree internal line angle, the shoulder with bevel has a beveled internal angle. So this 90-degree angle will be beveled. So you can have proper adaptation of your metal. Coming to knife edge. Knife edge and the feather edge margins are almost the same. So as the axial preparation is extending to the subgingival area, where there will be minimal amount of remaining dentin, you have to taper the finish line. You can't have a proper seat in cases of lower anteriors and in cases of periodontally involved teeth. In such cases, you have to either go with the knife edge margin or a feather line. So if you have a furcation involvement, feather edge is ideal, where the amount of axial reduction will be tapered to the cemental region, and there will just be a thin metal extending onto your root areas. Coming to aesthetic considerations. Aesthetic considerations has to be studied in relation to the type of restoration you are given. If it is a partial restoration or a full coverage. If it is a partial restoration, you have to consider occlusal capping, the help of all ceramic material, and masking the metal, and also the amount of ceramic thickness. If it is full coverage restoration, like in anterior regions, depending on the type of the tooth, the structure of the tooth, you have to go with the amount of reduction. You have to minimally have 1.5 to 2 mm in case of anterior teeth for all ceramic restorations, so that this will obey the optical properties of the material and you can have a good translucency in the final restoration. So once you understand, now that you understood the principles of tooth preparation, you can go with the ideal preparation steps for any fixed partial abutments, and if required you can actually incorporate additional features like boxes and slots for additional retention.